I'd like to remind people of some of the other misconceptions about sickle cell disease because it might help as they communicate to the families impacted by it. One, sickle cell disease is not an automatic death sentence, or there's not like a specific day that you say an age that people with sickle cell disease die. They can live full, productive lives, and it's our job to help them get there. Two, it's not contagious. This is a common misconception in the community. It is an inherited genetic disease. And I know doctors may think that that's a simple one, but it's quite important. Um, and three, going back to the concept of living a high quality life full of good well-being, this is achievable for sickle cell disease. And it's important to communicate that to patients because that instills hope and allows them to have more confidence, not only in their healthcare team, that they believe that they should be able to have a higher quality of life, but it also allows them to embrace and engage in their care plans all the more when they realize that their care team is saying out loud the fears that they have and helping them navigate those fears appropriately. There has now been a lot of advocacy and work to help fight several misconceptions of sickle cell disease. For instance, making sure people know that it impacts multiple types of ethnicities by doing awareness campaigns and allowing people to understand all the various faces, if you will, of sickle cell disease. That allows somebody with sickle cell disease to enter a space of care and be believed regardless of what they look like. And then into the drug-seeking concern, understanding that people with sickle cell are approaching a healthcare system because of that. They are looking for healthcare. They're looking for quality healthcare to manage a very severe complication. And pain is just one of the many things that can impact a person with sickle cell disease. But if you're focused on the concern that they're drug seekers, you are missing a lot of the big picture. And so there's been a lot of work done by the American Society of Hematology, the American College of Emergency Physicians, and several advocacy organizations and community-based organizations, such as the Sickle Cell Disease Association of America, Sickle and Sickle Cell Community Consortium, and so many others, who are busting these myths and educating not just the general community, but healthcare providers about the need to take sickle cell seriously and to not let these misconceptions impact care negatively. And so that looks like understanding that there are sickle cell guidelines for how to manage various complications of sickle cell disease, including pain. There's even a partnership between the American Society of Hematology and the American College of Emergency Physicians to actually work together to help emergency department physicians understand better how to take care of sickle cell disease pain. And it's interesting, one of the first parts of their instructions, like when you look at their guideline, is communication. Even before the medicines, even before the assessment, it's communication and understanding the patient, believing the patient, and this understanding that there have been these myths and these misconceptions that have impacted care for generations. So we can definitely share those links, but it's quite important to get the word out about managing sickle cell disease effectively, because that does impact the lifespan of individuals. When they get appropriate care, you see improved outcomes. I just hope that this article and this piece allows people to have more confidence in their communication with families, and also give some introspection into how they've viewed the community in the past and learn more about what it actually means to have sickle cell disease.